Welcome to lesson 3, where we're going to go over blood. So the pillar of blood in Chinese medicine is described as the substance that enriches the soil in which life grows. So fertility begins with rich and nourished blood. So if you take a look at these diagrams, you can see how vascular our uterus really is. And the muscle itself holds so much blood every single month and fluctuates as the lining gets thicker and thin, depending on where you are in your cycle. When the lining does thicken and prepares for a potential pregnancy and implantation, it brings in so much nutrients from the blood, from your prenatal, from the food you're eating, to help bring essentially like fertilizer into that soil to receive that embryo and give it such a good environment for growth. So blood plays such an important role in fertility to ensure that it's actually really good quality blood. It's nice and oxygenated. You have enough red blood cells in there to bring oxygen to plump up the area. It goes through the ovaries, so while your follicles are growing, enough vitamins, minerals, hydration, electrolytes, everything that blood carries, oxygen, is able to actually feed the area and give those eggs a great environment for growth. So not only does it play a role in the implantation and the pregnancy prep itself and the lining, but also preparing the egg itself and giving it a good quality environment for it to grow into a strong membrane and a strong situation. The vital role of blood in fertility. So in Eastern medicine, blood is more than just a physical substance. It is the carrier of nourishment, your life force, so qi circulates through the blood, and emotional vitality and consciousness, which we're not going to go into that deeply, maybe covered in Shen, the spirit, later, but it is said that the spirit anchors into the blood, and the house of the spirit is the heart, and the heart circulates the blood. Therefore, there is a spiritual component to the blood in your body. Therefore, like trauma can kind of store in the blood and store in certain parts of the muscles, and nice, healthy, free-flowing blood helps the spirit anchor into the body. So just briefly kind of covering the consciousness, emotional aspect of it. Healthy blood nourishes the uterus, supports the menstrual cycle, and creates an optimal environment for conception and pregnancy. Blood provides the physical foundation for building the uterine lining, nourishing the embryo, and sustaining pregnancy. It really literally is a garden bed. Like our uterus is a garden bed. It prepares every month, it thickens, the lining gathers endometrial tissue, which is basically like a blood-rooted thing, and it's plump and it's just waiting for that embryo to fall in, to feed it, to bring it into that lining for implantation. So the better your nutrients and your oxygen and the quality of your blood, the better that garden bed is going to be ready for literally fertilization and for a better implantive environment. The pathologies within blood specifically for fertility. So we're going to go over just the ones that affect fertility. The biggest one is blood deficiency. Blood deficiency is not quite the same as anemia or getting like your blood work done and seeing that your hemoglobin, your red blood cell count are within range. You can still be within range and have blood deficiency. So it's not the same as like anemia or those parameters in blood markers. Blood deficiency signs are pale complexion and lips, dizziness, blurred vision, very dry skin and hair, like a chronic fatigue, weakness, anxiety, poor memory, trouble sleeping, especially falling asleep. So if you have a hard time getting to sleep at night, that's a sign of blood deficiency. If you get dizzy, if you stand up too quickly and like kind of see stars in your eyes and ringing in your ears, this impacts fertility because it leads to insufficient nourishment of the uterus and reproductive organs. It also contributes to thin uterine lining, which makes implantation difficult. So that thickening of the lining, then the endometrial quality is just not quite plump and ready enough for implantation to be as successful. Also leads to poor egg quality, not enough blood, not good quality of blood, being able to reach those ovarian tissue and areas, irregular menstrual cycles, difficulty sustaining a pregnancy. Common causes of blood deficiency is overwork, chronic illness, excessive menstruation, so heavy menstrual bleeding every month, emotional stress, poor diet, postpartum depletion, so giving birth and not quite rejuvenating yourself after sufficiently, or having multiple miscarriages as well, and not properly nourishing after. Nutrient deficiencies, so like nutrient deficiencies that are not quite building the blood enough, and missing components that help the organs build the blood. Pushing the spleen and liver organs too far, or not enough nourishment for the spleen and liver, which severe stress, poor diet, over worrying, and mental distress injures the spleen and the spleen meridian, spleen organ, whereas like irritability, excess toxins, like overloading the liver with like hormones that are not metabolizing out, just things that damage the liver organ, liver meridian, can also contribute to not allowing them to do their job to build sufficient blood volume in the body. And again, you don't need to have like anemia or a diagnosis to fluctuate into blood deficiency. A lot of us have blood deficiency for a period of time after we menstruate. And in the East and Chinese culture, a lot of women drink blood-building tea and take like plant-based iron supplements and drink soups with like a lot of red meats, and iron building and blood building and volume building kind of herbs and foods after every period since like a young age, to just recover that blood that you lose from every menstrual cycle. Or if you work out and sweat a lot and lose a lot of electrolytes, you replenish as well. So we can all have episodes of blood deficiency or chronic blood deficiency. Doesn't mean you're anemic or like in that severe Western diagnosis. Blood stagnation and its impact on fertility. Blood stagnation occurs when the blood flow is slow, blocked, or insufficient. This can result from long-term qi stagnation, physical or mental stress, so long-term compression or bearing down, or stress that's like adding to an area that's not allowing the qi and the energy to flow properly, can result in the blood being stuck there and not properly circulating through. Infertility, this may present as painful periods, dark, large, clotted menstrual blood. So when you look at the blood quality, it's always a little like oxidated. You can tell it's just taking a harder time for it to shed from the uterus, so it's become kind of purple and brown. Large clots every time you sit, maybe to go to the restroom, you're just seeing big kind of chunks of that endometrial lining falling out. Again, oxygenated blood, dark brown purple. This can also lead to uterine fibroids, endometriosis, adenomyosis, thin uterine lining, or ovarian cyst, which there's many components that can lead to these things, but in our diagnosis, these are all considered ultimately a blood stagnation in the uterus, in the area of the lining. Difficulty with embryo implantation and early miscarriage can also be an outcome of blood stagnation. Stagnant blood prevents the uterus from being warm, nourished, and receptive environment for conception. So you can think of just an area that's not very circulated, not very plump, and has those good oxygen cells in there. We call it microcirculation areas. So like the capillaries are not in those crevices of the uterus that help the lining really grow around implantation phase. If these are kind of backed up and stagnated and old blood is just always kind of stuck in there, it's definitely not an ideal environment. And it's also susceptible for cold because it's not allowing that fresh blood to come in and clean that area out constantly. Eastern culture refers to the uterus as the baby room, so the temple of the baby room, and the environment needs to be warm with open circulation, reserves of nutrients in the blood, and a supple lining for proper implantation. So we really just want it to feel like a fertile garden bed that's warm, it's ready to receive, it has like a plethora of nutrients to pick from, and enough oxygen to help that tissue remain really healthy and bright and plump. So techniques to build and move the blood, which we will go over this later. Here's just kind of a basic, is eating enough blood building foods, which is like the foundation of Eastern medicine and fertility. And we're going to have so many tips and recipes and teas for this. Blood building herbal teas and supplements, which is like the foundation in the East that most women are already on like their whole life. Acupressure to nourish blood building organs and their meridian channels. So specifically like the spleen and liver, we want to work on acupressure points that help move the chi and the energy through them. So they're open and happy and they have all that they need in order to keep building your blood. When you lose blood, they pick up the slack and replenish it, etc. Gentle exercise like yoga, qigong to circulate the blood but not exhaust it. So we wanted to just move through those like capillaries, those microcirculations through the body to make sure that there's no stagnant areas or areas where the blood flow might be slower. Prioritize rest and emotional balance. Overthinking or emotional stress depletes the blood, which sounds kind of weird, like how can my brain affect my volume of blood? This goes to the spleen and liver. So the spleen is affected by excess worrying, and the liver is affected by stagnation and unrepressed emotions or irritability, like compressing down. These injure those meridians and organs and then thus affects their ability to build blood. And optimal sleep. When you're sleeping, your cellular turnover increases and everything can replenish and kind of rebuild from the day. So if you're not sleeping properly, you're kind of depriving the body of that reset and that regeneration and restoration. So it's super important. As women, every month we're losing blood. Like we have a menstruation, we're shedding a lining and extra blood to kind of push that out. And then so much blood gathers to the uterus after to start like thickening that muscle and building that endometrial tissue inside. So you can look at this diagram again. And it is just really important that after bleeding, we do replenish our blood supply. If you're someone who is giving a lot of blood every year or like gives a lot of blood for blood test because you're kind of doing like a lot of like Western diagnostic testing, so important to refer to the later modules where we talk about the tools to rebuild the blood. It is so precious and so important, and men don't lose their blood as much as we do, so we have to be extra careful, and our culture doesn't really teach us about this, whereas in the East, almost every tea or supplement or soup has like some sort of intention for women on replenishing their fluids and blood. So this is just for fertility, but blood itself has so many indications and importance in Eastern medicine. So that wraps up blood lesson. Again, another super important pillar in the Eastern medicine view of the important elements for fertility. So we will see you in the next lesson.